I'm LKruse. I'm going to do my lightning presentation. So 5 slides in 5 minutes. I will start the timer now. So in the world of treating children with an autism spectrum disorder, we need effective treatments. One of the most effective treatments is ABA, or Applied Behavior Analysis Therapy. However, it's often thought of as this science full of acronyms: BCBA, NCR, DRA, FCT, put it in the BIP, IAEB. Parents do not feel it's very accessible to them. They feel like it's something that needs to be done by the professional. So how can we start to bridge this gap? Because we know with this type of therapy that we need intensive services. And there's a multitude of reasons, sometimes financially, sometimes due to where they live, they're not able to get those intensive services. So parents may have to become implementers. Also, there's lots of research that shows that those receiving behavioral-based treatment will greatly benefit, or even 3 to 4 times better outcomes if parents are involved in receiving parent training and being able to implement some of these skills. So, one of those skills is discrete child training. So here's often what it's thought about of child sitting there a little bit, get your data sheet over there, you've got, ready to prompt, ready to reinforce or punish her perhaps. You got your PECs on the wall and your signs. So DTT is often thought of a very clinical treatment, something done by a behavior tech or by a BCBA, one-on-one with the child. It's not often thought of as something that parents frequently implement. However, parents can be trained to implement this, and training them could definitely help improve child outcomes overall. So how do we train parents? We need to look at kind of methodology within that. So behavioral skills training has a lot of positive research, both for staff training, for training for things within ABA, as well as things outside of that, for safe behaviors if you see a gun, for fire safety. So behavioral skills training involves 4 kind of components. So we've got the introduction. So parents first will be given a list of the 10 instructions. They will be read to them, and then they will get a chance to kind of practice, try out those skills in our baseline. Often training is just done in a lecture style. After that, then the next part of behavioral skills training is looking at modeling. So the experimenter, the trainer will model with the child how to go through those 10 steps of discrete child training. After that, the parent will get a chance to rehearse it as well. Then we're going to be training them on a tacting or labeling program, but they will also be implementing a interverbal program to see are they able to generalize between the two. After the rehearsal, then we will go into feedback, so we'll go through with them which steps they were able to do correctly, which steps they were not, and go from there. And keep practicing until they can do the 10 steps with about 90% accuracy, and 3 consecutive times. Then we're going to look at the issue of generalization. So all cats have 4 legs, I have 4 legs, therefore I am a cat, thanks to the dog. We need to look at, can we do a training procedure that allows them to implement a multitude of programs? So not just, oh, they can now label a cat, now I can teach them to label a dog, but can I teach them to label a cat and then teach them something with 4 legs is a, and the child can answer? Can I teach them to ask for a cat stuffed animal? Can we move between those verbal operands? And so we're going to be looking at that if we train them just in the tacting program, can the parents generalize those skills? Have we written them so that they program common stimuli? Do they need multiple exemplars, or can they do it with a single exemplar? We're going to be looking at those pieces and seeing can they generalize not just to those, but then also we will go into afterwards, can they generalize into the home setting? Can they maintain the skill and demonstrate it there? So overall, we're going to be looking at parent outcomes and, of course, child outcomes. Social validity is a huge component of ABA research. So I don't always change behavior, but when I do, I make sure to keep social validity in mind. We want to make sure that the parents feel this is valuable training, both for themselves and for their children. We also want to make sure what is the true social validity. So we need that dissemination piece, the acceptance and dissemination. So are they going to implement this? And then are they going to train others to implement it as well? So hopefully our results turn out the way we are hypothesizing, and